heard for years that LDL cholesterol is your bad cholesterol, and that HDL cholesterol is your good cholesterol. However, did you know that native or natural LDL cholesterol is not a concern when it comes to heart disease? The body needs it to transport cholesterol from the liver to the cell where it can be used by the body. However, when this LDL cholesterol becomes modified or oxidized by excessive free radicals, it causes a tremendous amount of inflammation in your arteries. It is this oxidized or modified LDL cholesterol that is dangerous to your health and not the natural or native LDL cholesterol. Therefore, the key is to try to prevent this oxidation process from ever occurring. Fat-soluble antioxidants like vitamin E, beta-carotene, and alpha-lipoic acid have the ability to actually incorporate themselves within the wall or cell wall of the LDL cholesterol and offer protection against free radicals and this oxidative process. The medical literature shows that the higher the level of antioxidants within the cell wall of this LDL cholesterol, the more it is able to resist this damage by excessive free radicals. In fact, Dr. Daniel Steinberg reported in the New England Journal of Medicine in 1989 that if you had enough antioxidants on board, LDL cholesterol would not be bad. The problem is that physicians are not able to measure this oxidized LDL cholesterol levels in the average lab. This is primarily done in clinical trials or in specialized laboratories. Physicians just look at total LDL cholesterol as their basis of whether or not to recommend whether you should be taking a statin drug. About 2 years ago, a panel of 11 cardiologists met, as it was reported in the USA Today, to lower the recommended level of LDL cholesterol from 130 down to 100. Obviously, the pharmaceutical industry was ecstatic with these new recommendations. However, it should not have come as a surprise to them, since 10 of the 11 cardiologists on this panel were on the payroll of at least one of the pharmaceutical companies. The problem with this recommendation is that nearly 90 to 95% of the population in the U.S. and Canada has an LDL cholesterol level greater than 100. These recommendations would mean that nearly the entire population should be taking statin drugs. The New York Times actually reported that maybe statin drugs should be placed in our drinking water. Well, to no one's surprise, statin drugs have become the most prescribed drug in the world today. Even though several clinical trials show that individuals who are at risk of developing heart disease can actually decrease this risk by taking statin drugs, researchers are really not sure if it is the lowering of this LDL cholesterol that lowers the risk, or if it's the anti-inflammatory properties of the statin drugs that improves their risk. However, the problem is the fact that taking statin drugs has its own risk. Statin drugs have been shown to cause frequent muscle weakness and muscle aching in patients, and in some cases even severe muscle damage that can lead to death. Recent studies also show the fact that statin drugs increase blood sugars, which actually increases your risk of having a heart attack. This has led to a dilemma for many physicians who tend to prescribe a lot of statin drugs to their patients. Now they must consider the risk of prescribing a statin drug with the risk of their patients having a heart attack. I feel that there is a better approach, and I will discuss this in detail in the next Medical Minute. I have always believed that we should use drugs as a last resort and not a first choice. Statin drugs are truly overprescribed.